about 2.5 years ago, I was appointed as the lead nurse with the view to setting up a centralized toxicity management service. And the reason for that was I've been working quite closely with Dr. Alton-Brown for quite some years now. Prior to being the lead nurse, I was an acute oncology AMP at the cancer centre, and I worked closely with her in the management of immunotherapy side effects. And she quite quickly realised that we needed to have a centralised service, and because there was a lot of differences in the way that patients were managed a post-acute presentation. So it kind of felt like having a centralised team to manage those side effects was a no-brainer, really. So basically, I was appointed, and one of the first steps was to do a pilot to see how we could manage patients, but via a telephone follow-up service. And that's what we did, with me in a room with a phone. There had been a business case put in place to fund a team, but in the meantime, we wanted to get things up and running. So what's happened now is we've gone from that 2.5 years ago to now having a team which consists of myself. I've got 2 AMPs who are clinically focused and are involved in inpatient reviews, outpatient clinics, and then I have a band 6 team of 3 nurses who carry out the telephone follow-up service. And what happens is patients are referred into us on acute presentation, and then for the first couple of weeks during their toxicity journey, they are monitored 2 or 3 times a week over the telephone, and a face-to-face review can be arranged if needed with the AMPs or myself. And then part of that process is to ensure that that they're on the right steroids, they're on the right tapering course, the patients understand why they're being treated, and to tell them a bit more about the toxicity journey and what's going to be expected of them, and to ensure that their toxicity resolves with the ultimate aim to get them back on treatment if possible. So what we do as part of that process is when they're referred into us, we make sure that they have follow-up with their oncology team to ensure that their treatment journey doesn't fall off track. And then and that's it sounds simple, but that's basically it. We monitor these patients, and that can be anything from 2 to 3 weeks to 2 to 3 months to even longer in some cases, but we take responsibility for them during that journey, but whilst working closely with their oncology team to make sure that they ultimately get the best outcome. Patients their feedback from patients is they feel very reassured by it. They feel informed. They feel like they've got a specialist team that they can go to if they do have any concerns. And as a consequence of the service, I'm currently in the throes of writing my dissertation, which is a service evaluation. But the initial findings from the service is that we have significantly reduced admission rates at the centre, and we've had an impact on admission rates throughout the network as well, because we liaise with the acute oncology teams and the peripheral hospitals as well. We've reduced the length of stay for patients, even if they do have to be admitted. And the one thing that I'm quite proud of more than anything really is that we've managed to significantly reduce our incidence of grade 3 and 4 toxicity, which ultimately means that potentially we're saving lives. One of the other really good points about our service is that working with Dr. Alton-Brown as the clinical expert, we constantly strive to move the service forward and make things better, not only for patients, but for the teams treating the patients as well. So we're always trying to think of new ways of working and how we can make things, more streamlined. Things like, we've piloted a patient self-care app so that they can actually do their own assessments at home on their smartphones, and then we review them. That's just one of the projects we're involved in. But I think what we also do is we provide reassurance to the treating teams. I know that prior to the pandemic, I'd been asked to go and present in different areas in the UK, and I think there's sometimes a reluctance to use these agents because of the lack of knowledge and the lack of service out there to manage the side effects. And I think what we do is we provide our oncologists with that reassurance that if patients do get side effects and toxicities, that, you know, we're going to be there to look after them.